My guest tonight is Professor Lehman. He's an expert as far as malaria issues are concerned. We shall be talking about the distribution of treated mosquito bed nets. Coming up next. Good evening. Thanks for joining us in the second segment of this news. My guest is Professor Lehman. He is a university lecturer. Good evening, Professor.
Good evening.
Cameroon will begin, or is supposed to begin, the distribution of treated mosquito bed nets in the country. Now, what explains this consistent distribution of mosquito bed nets? It seems like malaria does not want to leave Cameroonians.
Yes, I want to remind that malaria is still our main public health problem in this country, since we are in a region where all weather conditions permit the breeding of mosquito. It means transmission is still very high. And about the distribution of mosquito nets, I want to remind you that 12-11 December was the first round of massive distribution of mosquito nets. It was, I think, we distributed about 8 million, little more than 8 million mosquito nets. And now the new campaign is launched since the 23rd of October, and now we are going to receive more than 12 million, I mean about 12 million insecticide-treated mosquito nets.
That's 12 plus 8 million gives you 20 million. Now, it's not every Cameroonian that has been given a treated mosquito bed net. What explains this? There are other reports that the bed nets are not given according to the homes. They are given according to the number of persons in that. Now, if you have, say, 7 children, they give you 7. What is the use?
So I beg your pardon, I have to correct a little bit. This addition, 8 plus 12, is not the right one, because since 2011, we have about 4 years gone. So most of the people using mosquito nets are no more using them. Some are not still not no more fit for the use.
So it will be redistributed to them?
No, now they are restarting distribution. And the distribution, having a mosquito net per se is good, but using it is something else. So I think it's very important for those who receive mosquito nets to use them properly. And I think that's the problem. We distribute, even the distribution is not easy, because I'm not part of the team, the government team which run this project, but I know having fundings for such operations is very difficult.
And managing the funds, very difficult too.
Exactly. Managing the fund is very difficult, and even the social problem, you know, distributing bed nets means people should volunteer for that. And during the last operation, I realized, since I was part of it, I realized that it was very difficult to have people really volunteering for such a work in our country. People are not used to work. A lot of them, I don't want to say everybody, but a lot of people are not very used to working for the social well-being of everybody. Now, so it's not easy at all.
Now, away from treated mosquito bed nets that are being distributed to Cameroonians, what other cure for malaria?
Yes, your question is very important, since malaria is such a disease that we cannot defeat using only one mean. You know, now the Ministry of Health distributes, gives treatment for free. You know, treatment for pregnant women is free since many years. But plus the distribution of mosquito nets is another measure. The fact is that malaria prevalence in our country is so high that we need to really think about eliminating malaria. We need to use a multilateral, multidisciplinary approach. It means we have to look about the diagnosis, we have to look about the treatment, and to look for a good prevention.
There must be some behavioral changes too, maybe on the part of the population?
Of course. Hygienic measures are very, very important, and I think raising awareness of those who are concerned is very important. And the job you are doing, I mean, sensitizing the people, communicating about the disease is a key activity to fight against malaria.
Now, those who are watching you, most of them don't see the importance of using treated mosquito bed nets. Immediately you give them some, go fishing, fishing with it and all that. What could be the importance, and how can you sensitize the population on that?
Yes, as I think as malaria researcher and as a citizen, I can only say mosquito nets are efficient and people should use them. The first study I had, I was lucky to participate in, was in Kumba in the 90s, in the early 90s, and the question was still to know if insecticide-treated bed nets are efficient, and that is known since. Now the problem is to distribute them properly, and for those who receive them, they should use them properly. So it's really a good tool, a very efficient tool to fight against malaria. Malaria will surely drop, I mean malaria prevalence, but to be more efficient, all those other measures coming together with the use of mosquito nets should be implemented. I mean using the right drug, and we don't have to be ashamed of what we have here as our local
methods of
yes, but they should be controlled. I mean we have our plants. We have to do more research to have the best tool, the best molecules, and the best doses for malaria treatment.
Which means the Ministry for Scientific Research is also implicated in this, not only the Ministry for Public Health.
Absolutely. The Ministry of Public Health, the Ministry of all the ministries which are in charge of education, of communication, and I mean it's a global fight which should be really fought to defeat malaria. And in our country, it's I think somebody should look very closely at the fact that in our primary schools, you have children who complete their schools without knowing what the disease is. Even some who go right to the university, they don't know about symptoms, they don't know about the vector, they don't know about what should be done simply to avoid malaria, and that is not acceptable.
Okay, you are in the field. When can the rate reduce in Cameroon? 2020, 2025, 2035?
No, I won't say something I don't master, but I think with the use of mosquito nets, the one they distributed since 4 years, we had a drop of the prevalence. I think we might probably still have a drop, but to have a significant reduction of malaria transmission, as I was telling you, we need to have a pluridisciplinary approach. I'm talking about diagnosis, and now we have tools for mass diagnosis. We have good treatment, molecules. The approach should be synchronized. It should be an approach where we have clear targets, and the target should be malaria elimination. The target should not be just to reduce the prevalence.
All right. It was a pleasure having you, Professor Lehman. You're an expert when it comes to that. You're equally a university lecturer.
Thank you. I do my best.
It was equally a pleasure being with you tonight. The 6 p.m. primetime newscast on Equinox Television. Good night, goodbye from Douala.